Okay, Jill, we're going to inject some Botox here. And the muscle that we're working on today is called the glabella. And the Botox will be injected in about 5 different injection points, and it'll make it so that you can't scowl anymore. Scowl for us. So it doesn't work instantly, it takes a few days, but then when it kicks in, you won't be able to move these muscles anymore and have that angry scowl.
Super.
So usually I'll use a little bit of ice beforehand so that you don't feel it as much. It's a very small needle that we're using. It's a 33 gauge needle. And I'll do a couple of pokes here and show you. Scowl for me. Okay, relax. So that's how it feels. What do you think?
That's not bad at all.
And Botox can be injected in many different areas of the face. This is probably the most common area that we inject. Anywhere where we want to weaken the effect of one of the facial muscles is where we use it.
Is that most often in the forehead?
Most often in the forehead or around the eyes. Those muscles are the most responsive to Botox. But there are a few other areas as well. Sometimes I put some in the neck bands. But usually you're right, around the forehead and eye areas, the most common. We're almost done. Okay, and I may do one more, just scowl, one more on each side. Okay, relax.
And how quickly will I see the results?
So you won't see anything probably for about 3 or 4 days, and then after that you'll start noticing that it's just a little bit weak when you try to make that motion with your face, and by the time usually 1 week has passed, and it's usually fully effective. All right, Jill, you did it.
Super.